Welcome to Inner Beauty Code, everyone. I am so excited to be here with today's guest. Her name is Dr. Carolin Klein, and she is a sex therapist and registered psychologist out of Vancouver, Canada. Thank you so much for being here today, Dr. Carolin. How are you?
I am great. Thank you so much for inviting me on. I'm thrilled to be speaking with you today.
Amazing. So tell us more about what you do.
Sure. I am a registered psychologist, but I specifically work in the area of sex therapy. So, I co own and co run a clinic in Vancouver, Canada called the West Coast Center for Sex Therapy, where we work with people, individuals, couples, other partnership configurations, helping them with anything to do with their sexuality. So, that can include everything from working with couples where there's a desire discrepancy, working with people with sexual pain conditions, sexual trauma, concerns about sexual function, so ability to orgasm or become aroused, keep an erection, problematic sexual behaviors, or what often people refer to as sexual addictions, and lots of sexual shame and anxiety. And then on the other end of the spectrum, couples who are not in distress, but who just want to evolve with their sexuality in some way. So, couples and partnerships where they want to explore new ways of being sexual, and it's really from this positive lens of growth and continued learning together.
There's so many questions I have for you today. I am so excited that I hope I remember to ask you everything. But what I would like to start with is possibly talking about some things that are maybe not so commonly talked about in the open, like maybe let's start with sex addiction. So I've always been curious about this, and I know there are people with that struggle with it, or if it's a partnership between a man and a woman, that where the man struggling with sex addiction. And yeah, how do you navigate through that? And maybe you can give us like a further explanation of what it actually means to have a sex addiction, and as well as maybe porn addiction, just addiction to those two things regarding sex and sexual activity.
Yeah, great place to start. So, the first thing I'll say is there is a lot of controversy around the term sex addiction,
Hmm.
and that's because there is not complete agreement about this. Addiction specialists and clinicians really define addiction in a very specific way in terms of what happens in the brain and the body. And the interesting thing is that while there is no doubt that people can struggle with their sexual behaviors, just like people can struggle with their shopping and their eating and their social media time. So, for sure, people can struggle with their sexual behaviors. When people call themselves sex addicts, the interesting thing is that the researchers say that when they look at what's going on in the brain and body, it's not the same as what's happening in someone who has an addiction to something like an opioid, nicotine, alcohol. And so I have no problem when people come in and say, like, I'm struggling with sexual addiction, because what that means to me is they are finding their sexual behavior to be problematic in some way. But I do try and educate people that addiction may not be the right term, in the sense that what's going on in the brain and the body is not the same thing as with other addictions. And so our treatment approach also sometimes needs to be a little bit different than it would be for something that's actually a physiological addiction. So, more often in our field, we talk about it as problematic sexual behaviors or
Okay.
behaviors that feel out of control in some way. But either way, we're talking about the same thing, behaviors sexually that are creating a lot of distress for either the person themselves or their partner or their relationships in some way. And pornography, then, same thing. We definitely are seeing that people are using pornography very differently than they did. When I was growing up, we didn't have internet pornography. People maybe had a Playboy magazine or a stack of them. You went to the video store and you got a VHS and you watched it from start to finish. You browsed the magazine, 20 times through. And now with internet pornography, what's available to people is so much novel stimuli. People are often watching porn with five windows open and they're clicking, and there's so much novelty that, of course, this is highly reinforcing for the brain, just like our video games of today versus playing a game of Monopoly, it's kind of apples and oranges. And so we do see that a lot of people are, just like they're spending a lot of time on social media, they're spending a lot of time watching pornography in a way that's not healthy for them. because just like social media, it's getting in the way of them doing the things they should be doing. Sometimes they're putting all of their sexual energy there, and their partner later on wants to be intimate, and they've already had an orgasm and they're not going to again. They're kind of run out of steam. So I really sort of put the porn addiction piece in the same category as today's social media and screen time. Is what is the impact on your other things that you want to get done in a day, on how you feel about yourself, and in how you can show up in your relationships, and helping people to recognize that partnered sexuality, especially, if you're in a monogamous long-term relationship, it's not going to compare where you've got one person whose eyes you gaze into over and over and over again for 40 years versus pornography with 5 screens open and tons of novelty and clicking. People are going to find that when they're sexual with their partner, that it doesn't feel as arousing because they've gotten used to this high contrast, this huge stimulation, and then over here, not a lot of novelty. And so I do recommend to people, same thing with social media and screen time more generally, make sure that you're limiting how much of that becomes a part of your daily habit because it's going to impact your relationships.
Yeah, and I guess going back to the actual definition of what an addiction is, and maybe more looking at this through the lens of problematic behavior when it comes to porn specifically, we'll start with that because I was actually having this conversation with some friends and have had it many times with people, and I think the way that we learn to have sex, like most people don't get their education solely from experience. It's watching this movie or these situations that are not real, and then it almost becomes addictive behavior to being stimulated, like you mentioned, as you do with social media, and how we all are just completely overstimulated in our lives all day long with all the devices that we use, where I think then the problem comes into when you can't make that connection with a person, in a human person in real time with a partner, and that's where it can cause a problem with you being able to connect to people. So maybe looking at it from that perspective as to why it is problematic for people and how it can affect, just giving people more in-depth view of how this can be problematic and how it can be detrimental almost to being able to create connection with an actual person when you are getting your stimulus from your computer screen or from your phone or whatever. Because I know a lot of men who masturbate through pornography many times a week, many times a day, and then that can almost become numbing after a while and never enough. So how do you how do you navigate through that, and how can you maybe explain maybe more as how it can be problematic long term for you, and why it's, if someone is used to watching porn, how they can maybe try to reframe it and look at it differently and maybe try to break that pattern of behavior.
Yeah, yeah, great question. So, the first thing I'll just make sure, porn is a very controversial topic as well, and sex therapists were pretty neutral on it in the sense that I always say, there's nothing in life that is all good or all bad. You can use a
Mhm.
hammer to build a house, or you can use a hammer to smash one in. And sex therapists definitely at times will recommend the use of erotica and even pornography for certain people when it actually is in line with their goals and helping them to explore some of their fantasies, helping them to think about sex a little bit differently. At the same time, I definitely would never say that porn is a good source of information. And I think you've even were having this conversation recently with another guest, Mint, or maybe it was your own thoughts out in the episode afterwards. But like pornography is very fictional. It is this thing that is designed to stimulate the brain, it's not designed to educate. And it is definitely a huge problem. It's not even porn's problem. It's the problem that we live in a society that doesn't talk openly about sexuality. That when we raise kids and they watch some sort of movie, Tom Cruise and Mission Impossible, parents will be like, well, that's not real. You don't have to worry about that. But parents do not sit down and have that conversation with their kids. If you're going to watch pornography and it's going to show all of these women and vulva owners climaxing from deep thrusting penetration, but just so you know, that's not usually how most women orgasm. And just so you know, most penises aren't actually that size. And, like no one's giving the education. And so when there's not education and then young people are seeing pornography for the first time, and it's kind of like McDonald's, it's engineered to be really like lovely. And these people want more and more of it. That's their only idea of sexuality. And the things that porn always leaves out, it always leaves out how to talk about consent. It always leaves out how to have safe sex. It always leaves out how the body actually works. So people do a lot of things that they're emulating from pornography, and it's actually not very pleasurable, but people don't know. So they think, oh, I should like this. This is what people seem to like in porn. And so it's leading to a lot of pretty crummy sex if people emulate what they see in porn and don't see porn as entertainment. And then the second piece is that people are often, because they don't know how to interact sexually with another human being in a connecting way, it becomes easier for them to just turn on the computer and masturbate to porn because they don't have to deal with, am I good in bed? Is my partner really satisfied? Am I a good lover? They just get to have this pleasurable experience with themselves without all the shame and anxiety. So we do see a proportion of people come into our office where they're saying, yeah, like I'd love to have great sex with my partner, but I don't feel comfortable. I feel really anxious. So it's just easier for me to just engage in solo sex. And again, I don't want to blame that on porn. Porn is what they turn to, but it is the case that we've got to help people to know how to have better sex, more connecting sex, and talk more openly about it.
Yeah, that makes a lot of sense and is a really helpful explanation. The first thing that you were talking about was sex addiction. So, this is a question I have just in general about partners. Like, I know a lot of single people, and I think I don't know what the answer is to this question. And I'm very curious to find out what it is. But there seems to be a lack of connection, I think, these days with people who are single and aren't married. There's like dating apps, and again, maybe it's just the ease of availability when someone does want to have a quick connection with somebody. But I think it can be a fine line, maybe being unhealthy when that's all that you're seeking from connection from people, and you're not seeking the actual connection beyond that. I know that there's a lot of single people that are finding dating these days to be an interaction of the sexual kind. Like once someone has sex, it's the relationship's over. So basically, I want to ask, why are things so casual these days, and why are people just seeking out like quick, easy sexual experiences? It seems like amongst single people, is it availability? Is it people wanting to see what's better out there than what's sitting in front of them? Do you get kind of what I'm
Well,
asking?
yeah, I think I do. Let's see how I answer it. I mean, I think it's a complex thing because we humans are complex, and I don't think we always
Yeah.
do things for the exact same reason as the next person.
Mhm.
So I'll give some of my general thoughts, but again, I think there's lots of variability. One thing I'll say is that I think that as we have more easy access to things, we
Mhm.
tend to take advantage of that. As we have more fast food restaurants, we eat more fast food and we get
Mhm.
DoorDash or whatever delivery service is there. Just the access to becomes the new habit. And again,
Mhm.
we're seeing that with eating habits. It's not just sexuality. It's the idea of like, can I get something fast? I have the urge for food. I'll just order it. I have the urge for groceries. I'll just get them delivered. We are right now in like a, hey, I want it, so I'm going to get it kind of a mode. And the
Mhm.
same thing I think is true with sexuality is now like I have an urge, so I'll just go on porn or I'll go on Grinder or Tinder or whatever it might be. We right now, that is like a global way of like, I want something, so I'm just going to order it online and Amazon will deliver it to me tomorrow.
Mhm.
And I think that's showing up in sex as well. So I think that's a general kind of thing that's happening right now.
Mhm.
The second thing is, and this part's not all bad, is I think that there is more acknowledgement of the idea that sexuality is okay for quality of life. And we've moved away that sex is just something that happens between a heterosexual married couple. And it's
Mhm.
now become like, hey, can people explore their sexuality a little bit? Is it okay to say, you know what, I would like to experience something? So I'm going to put on my Grinder or my Tinder profile. I'm looking for someone who will explore this thing with me. And in some ways I would say, as long as again we feel good about it before, we feel good about it during, and we feel good about it after, we don't pay a big price for it, then how lovely that now we can explore mountain biking and sexuality and cooking, and it becomes one more piece of quality of life. We've moved away from the idea that there's only one right way to have sex within only one kind of relationship. So there's some positive stuff to it as well. But I think then the third piece is the validation piece. And again, this isn't just in sex, it's in social media, it's in everything, is that there are a lot of people who will get a lot of quick validation from a quick sexual experience where they might feel like, wow, somebody wanted me right now. I was good enough that someone would choose to get that vulnerable, get undressed, and be intimate with me.
Mhm.
And that's kind of like getting likes and followers. It's kind of like, again, I'm going to put addicting in quotation marks, not addiction in the sense that clinicians use that word, but in the
Mhm.
sense of like really reinforcing that for some people, they do show up in our office and sexuality is a form of validation for them. And they don't even necessarily love the sex. They don't necessarily feel good about it afterwards, like the social media example. But it's this thing that's feeding for them in a moment of low self-esteem something. So I would say all three categories are the most common ones that I am seeing.
Thanks. I think you answered it well for that very broad and roundabout question I asked. Thank you. Um, but yes, it's interesting to get your insight on that topic of what you find common through the lens of your experience in this subject. So thank you. Um,
Thank you.
I wanted to ask you now, maybe switching gears, about sexual shame and anxiety around sex. So I have talked about this before with other or some sexologists and sex educators about just looking at how society views sex, and maybe I think it is changing and people are becoming more open to that. So maybe can we touch on that a little bit about what you see as a common thing for women and for men across the board, and then some ways to overcome that, or see expressing yourself or finding your own sexual pleasure to not be something that is to be looked at with through the lens of shame or guilt or fear for wanting to pursue that.
We have such a long history of shaming sexuality, and particularly for women. Women's worth, whether they're considered marriage material, has been tied to their virginity. Women for sure have been called all sorts of horrific names, their body parts. One of the things that I've shared on a couple of other podcasts as well that I was shocked about as a quick story here. A couple of summers ago, I had a relative from Germany coming and staying with us, and we were talking about sexuality and how we get raised as women to hear the word vagina but not vulva. And I said, because I was born in Germany, but I immigrated to Canada when I was about 2 years old. And I said, my parents, I always knew the word for vagina in German, but I don't even know what the word for vulva in German is. And he told me what the word is. And the word is Scham, which is the German word for shame. So literally, the word for a woman's vulva in German is shame, her shame. And I was shocked and I was like, what? How are we not trying to, like, we petitioned to have lots of words removed from our vocabulary. How is this word not being petitioned to be changed? Because how horrific that girls are still being raised to know that this is their shame. So, and in looking at it further, there's actually many languages that use the word shame to some degree in the way that the word vulva is defined. So we have a long history of shaming women and their sexuality, unless it's in the confines of a heterosexual marriage. And I always really love what Brene Brown, the big researcher on shame and vulnerability, says. She says, if you put shame in a petri dish, it needs three things to grow exponentially: silence, secrecy, and judgment. And I really think that's how we treat sexuality. With kids, if they ask questions, we say, oh, we don't talk about that. That's not appropriate. We grow up keeping our masturbation completely a secret. Married couples don't talk about, hey, are you interested? No. Okay, well, I'm just going to go and take care of it myself in the bedroom. Everything is hidden and our sexual fantasies are hidden. We're terrified. Are we normal for what we want and desire? If we catch our partner watching porn, masturbating, then we feel betrayed by that behavior. We are, so there's the judgment of what are you doing? Why would you need that? We've continued to put those three elements in. And then Brene Brown says this lovely piece afterwards, and she says, but shame cannot survive being met with empathy and spoken aloud. And I think that's where we really have to get to is, I'm so thrilled that you invited me on your podcast because it's one more opportunity to talk openly as a woman, as a professional woman, and say, you know what, our sexuality is a part of who we are. It's how we often connect. It's how we often feel most close to someone else, is to take our clothes off and to allow someone to touch us in that way. And so the interesting thing is, while so many people see sex as this frivolous thing that you do when all the important things of the day are done, on the other hand, to be without sexuality for many people means that they never have that level of connection. They just feel like roommates, etc. So we're in this dichotomy of you shouldn't want sex too much, but if you're not having it at all, then something must be wrong in your relationship. So we shame it at all ends and angles. So my big thing is, how do we talk more openly about sex? And I think it needs to start with children. There's this big fear of sexualizing children, and that if you answer their questions, you will sexualize them. And I think that that's such a bizarre notion and not at all supported by the research. The research is really clear that children who have more education make better informed decisions. And that's about everything. It doesn't matter what the topic, and that includes sex. Kids that know about sexuality take longer to have sex. They have less teen pregnancy, less STIs, more contraceptive use, and very important for many parents, because they've learned to talk about it from an early age, they are more likely to come forward and tell an adult, a trusted adult, when something is going wrong. And that's what we want. We always say to kids, I want you to tell me everything. But kids won't say everything if actually the parents half the time say, why are you asking me about that? Who told you about that? We don't talk about that in our homes. We give mixed messages. And I always joke, my daughter's now 10, and I always say, she knows about sex so much, she's going to be 80 before she has sex for the first time, because the research again shows the more we know, the longer we take to have sex, because we wait for the right time. We wait for the right circumstances because we know what good sex is versus bad sex. And we don't have to learn by saying, I don't know what this is, so let me try it out for myself.
Yeah, I think that is such an important point because I think the way that most people do learn it, like we mentioned before about porn, or you just are thrown into a situation not having any information and trying to figure it out by yourself. And going back to communication and talking, I think that is the key to making any kind of relationship period work, and especially the aspect of sex in a relationship, because I mean I have a lot of married friends and a lot of married people that I've talked to about the topic of sex, and I'm just shocked at how common it is for a couple to have no communication around sex, and for them to go, months without having sex, or hearing a friend of mine talk about how she doesn't want to have sex with her husband. I mean, there's obviously so many reasons emotionally that could contribute to that, but just the fact that there is no communication around that, or they feel bored or feel like it doesn't, oh, like who wants to have, steak every night for dinner for the next 20 years. I actually have a friend that said that, and I'm just like, don't, how can you talk about your husband that way and think that that's going to grow the intimacy between you, and I think just making it normal to have these conversations is absolutely essential to making a relationship last, because we've mentioned it before on this podcast about, sex not being able to make a partnership last, but it certainly can contribute to the demise of a relationship, and then people looking outside of the relationship because they're not getting their needs met there, or they have a partner that's closed off and refuse to talk about it. So yeah, I think everything that you said is just so important. And on that note, how can people start to open up and talk about this? Because I know part of the shame can be just being able to admit what you want to experience or what you want to explore with a partner. So can we touch on that, and anything that you have, any insight you have around creating more intimacy and deeper connection?
Yeah, beautiful question. So I think that because so many people, yes, they've never had role modeling of how to talk about it in a healthy way. It's not comfortable for them. There's going to be a spectrum of some people who are going to start with just dipping their toe into it and then gradually more, and others who are ready to actually make some pretty big changes right away. For the people who are really anxious about talking about sex, they grew up in households that said you don't talk about it. Sex is something you do. You don't need to talk about it. It can be really tough. And I think again, your podcast, other podcasts, where we're we're just giving people an opportunity to hear others talk very bluntly and openly about sex is already a first step. We learn through observation and hearing. And again, we don't want that to all be porn, but if we can do it through these podcasts, if we can do it through reading articles, and then kind of progressing, that there are some amazing workshops being put on by professionals to help people. And that's with partnerships as well, couples and other partnership configurations of like, let's open the communication and let's give some really good tools and examples and facilitate those conversations. I think the idea of treating sex just like everything else. So if we can say to our partner, you know what? I have never tried that food. I'm kind of curious. I don't know if I'd like it. What do you think? To be able to say that exact same line with sexuality, to be able to say, hi, you know what, honey? Like, I've heard about this thing. I've never tried it. It's just kind of new on my mind. I don't even know if I'd like it. What would you even think about us doing that? Is like, why wouldn't we say that? Why wouldn't we talk about sex in the exact same way? Um, and so I say to people, whatever sentence you're saying anything else about, let's put the sexual words in there as well and see if you can just practice that because it shouldn't be a whole nother language to talk about sexuality. The third thing is being really curious and asking your partner, inviting them. So it's not always just us having to go out on a limb and share what we want. It's also saying to our partner, hey, like I'd love to get to really know you. I think intimacy really is that we know someone else better than anybody else out there. And saying to our partners, you know what? I feel like I know all about your retirement dreams. I know all about like your beliefs on family. I don't think I know you sexually very well. I know what we do in the bedroom, but I don't actually know what's on your bucket list to try before you die. I don't actually know what your worst sexual experience has been versus your best one. I wonder if we can have a, glass of wine or a cup of tea and just like I just want to get to know you better. Those would be beautiful conversations to have. And the last thing I'll quickly say about that is, I think there's always this piece that sometimes people are only talking about the negative. They have a sexual experience, it doesn't go really well, and then it comes up right in the moment. And that, of course, has a lot of potential pitfalls. So ideally, people are talking about sexuality not when their clothes are already off. They are talking about it well beforehand, where it is this relaxed, comfortable environment, and there isn't pressure to get turned on, there isn't pressure to act on it, and people can just say like I'm just curious about you, and there's no judgment, and then people can change the topic if it's no longer feeling comfortable and come back to it at a later time.
That's amazing. Yeah. Look, like take the fear and anxiety out of it and make it more of a conversational, normal thing than making it this big, scary topic that we're, overhyping it in our minds to create tension around it to be able to get past that and just talk about it as a normal conversation. Yeah. That that's nice. One other thing I know that some people experience as part of the reason why maybe they don't explore sex or maybe they haven't had been able to have a pleasurable sexual experience is pain or physical discomfort when it comes to sex. So maybe can we explore that topic a little bit? I actually am not really sure what the clinical or medical terms are for something. So can we bring that out in the open? Because I do have women I've known over the years who didn't like to have sex with their partner because it actually caused them physical pain. And then, not to leave the men out, but I know a man that had a condition where the shaft of his penis started getting scar tissue. So it became just painful without even having an erection to have that going on. So I think that's something that a lot of people are really not aware of, can be something that creates tension for them when it comes to the topic of sex.
Yeah, I'm so glad you're asking about this. This is very dear to my heart. I spent years as director of a vulvar pain program here in Vancouver at Vancouver General Hospital. So I understand sexual pain very well. And the first thing I always say to people is our genitals are not some separate part of our body. We experience pain in every part of our body: hip pain, neck pain, back pain, knee pain. So why wouldn't we also have genital pain? It's not like the brain says, let's leave that part off limits just because our society doesn't like to talk about it. So yes, sexual pain or genital pain is incredibly common. And there's many different conditions that can lead to it, just like there's many different conditions that can lead to knee pain or neck pain or back pain. It's not one thing. Our general term for painful sex is dyspareunia. That's just like the general global term. If we were going to say that, well, clinically someone has dyspareunia, all I know then is the person is having pain with sex, but I don't know what the cause is. And as you're saying, with men, we can have many different causes, and sometimes there can be this buildup of scar tissue, as in Peyronie's disease. Sometimes there can be pain with the with the foreskin being too tight, as in phimosis. Sometimes for women, there can be vaginismus, which is where the pelvic floor muscles are involuntarily contracting when the woman is wanting to insert anything into the vagina. And that's very painful to try and insert something when it's hitting against the wall. We can have conditions like vulvodynia, where it's a chronic pain condition, and other medical factors. Infections, skin conditions, cancerous conditions have been ruled out, but the central nervous system, the brain is sensitized and is emitting a pain response to touch that would not normally be painful. So many different things. Prostatitis for men, the list is huge of the conditions that could result in genital or sexual pain. So the most important thing is that as soon as people feel pain during sex, and it's not just happening one time, it's happening repeatedly, it's not a one-off, they should be seeing a specialist doctor. And I wish it were the case that all doctors are trained in sexual pain, but doctors are generalists for the most part, are physicians. And just like they can't diagnose every eye problem, we get sent to a specialist, same thing. When it comes to genital pain, most general physicians get very little training in all of the conditions that can lead to it. So generally, we're thinking of a specialist gynecologist who has done some very specific training in sexual pain, or a specialist urologist. And they will do a very specific exam to figure out, is it an infection? Is it a skin condition? Is it an autoimmune disorder? Is it a cancerous or precancerous? They're going to try and figure out what it is so that the treatment can be properly applied to that condition. The one difference I'll say, and I just did a social media post on that yesterday, is the difference between discomfort and pain. You know, every activity in life can be uncomfortable. So yes, if you have sex in the car and the stick shift is digging into your side, it might be uncomfortable if your head's banging against the headboard. So discomfort where you're kind of like, oh, I want to change position, is not uncommon, and we don't think of that as a problem. But when your brain is actually saying ow, whether you're verbalizing it or not, and making you want to withdraw, we definitely don't want people to continue to have sex that way, because it will naturally shut down desire. Pain is designed to make us not want to do whatever is eliciting the pain. So the problem is, a lot of people, especially women, will white knuckle through pain, thinking that, oh, I was told sex hurts. I was told that that's normal. I should just have a glass of wine. I just need to relax. And then what they find is that over time, their desire goes down and takes a hit, and their arousal takes a hit. They're getting less lubricated. But arousal is a natural analgesic or pain suppressant. So, a lot of women will masturbate when they have menstrual cramps, because arousal and orgasm leads to a reduction in pain. But if now we have less arousal, now not only is it more dry and the vagina is not lubricating and expanding, which also leads to pain, but now we don't get the analgesic properties either. So the big thing is, get an assessment from someone who knows sexual pain, not just a general physician who doesn't have training in it. Make sure the treatment fits the proper diagnosis, and make sure you're not continuing to white knuckle through pain, or the snowball of consequences just grows and grows and grows.
Thank you so much for sharing all that information, because I'm sure someone listening out there has experienced one or some of these conditions. And I know a lot of people have no idea that this is even a possibility, or like you mentioned before, it's just supposed to feel that way, and they don't think anything of it to go seek help, or maybe seek an alternative method of figuring out how to make it better. So, on the opposite spectrum, my next question is about pleasure and pleasure gaps. And so, I guess through the lens of looking at sexual education when it comes to pleasure, we have talked about a little bit before on this podcast as well, just what happens actually physically to a woman's body, to a man's body, when they start to experience arousal, and why maybe it's really important for both sexes to understand this. I mean, and obviously, if you're having sex with same sex partners, it could be useful to understand this information too if you're not already aware of it. So can we explore that topic a little bit of what's happening physically to your body with arousal and maybe the gap between the sexes on that?
Sure. So, in terms of physical or physiological arousal, and we really do distinguish between mental arousal and physiological arousal. So, physiological arousal is that we start to have this sympathetic nervous system activation where we do have this increased heart rate and blood is moving to the core of the body, including to the genitals, which will lead to an erection response in penis owners, which will lead to a vasocongestion response in vulva owners, where the vulva and vagina, the blood vessels become innervated. There's a lot of blood there, and this leads to a whole bunch of responses. We get this tenting response where the vagina and the cervix are shifting. The vagina becomes elongated. The cervix moves out of the way so that you hopefully don't have this feeling if there's penetration of something banging against the cervix. The vagina lubricates, and that again is really necessary if you're going to have a lot of friction. Just like when you go and see massage therapists, they're usually going to use some sort of lotion because they're rubbing your skin for an hour. And so we want to have skin that is more plump. We want to have skin that's more elastic and that can accommodate something. So there's all these changes as blood moves down into the core of the body. There are some other changes that happen as well with sympathetic nervous system activation. Our perspiration rate changes, our breathing changes, our pupil dilation changes. So lots of different changes, and that's what we consider the physiological part of arousal. I think it's also important, though, that we recognize that there's also this mental piece of arousal. And a lot of people assume that if there's physiological arousal, that it means that there's mental arousal. They think there's this perfect correlation. And I think some of the most interesting research that has changed our way of thinking about sexuality is that we now know that women have a lot of what we call desynchrony or discordance. And that is that a woman can be totally turned on mentally. She can be really in the moment. She can be thinking about this is super, super hot. But you may not detect much in her genitals as a result of, for example, breastfeeding, which increases prolactin levels and decreases estrogen levels, so you get less lubrication. It can be the result of menopause, for example, different medications, stress, etc. So sometimes people will be like, "Why am I not wet?" Or their partner will say, "You don't seem very turned on," because they're just referring to the woman's genitals. And we have to listen to her words, not her body, when she says, "Actually, like this is lovely. Let's just add some lube on." Or vice versa. We have that women can have a physiological response because the brain is interpreting something sexual is happening. So let's prepare the body for possible penetration so there isn't tissue damage. But the woman might not be mentally aroused at all. She's thinking, oh, what color to paint the ceiling and what to make for dinner. And so again, sometimes I'll have a heterosexual couple in my office and she'll say to me, I really struggle with my desire and arousal. And he'll say, no, you don't. You get really, really wet. And that's because he's again looking at her body as the truth teller rather than what she's saying. So women have a lot of this dysynchrony. We can have what seems like no physiological response, but high mental arousal. We can have low mental arousal, but a huge physiological response. We need to ask people what they're actually thinking and feeling. Men can also have desynchrony. We'll see it in sexual assault cases, for example, where mentally it's not arousing at all, but the body is having a physiological response in men and women. So same thing in men, we have to ask too. And just because a man doesn't have an erection does not mean he's not turned on. There might be other reasons for the lack of erection. So I always like to make sure people don't think of the body as the truth teller. It is our mind. It is what we say we're feeling, but we need to then be open and honest about it. And then the other part of your question, the pleasure gap. So we do have a huge pleasure gap. I always say it's not just a pay gap, it is also a pleasure gap. So the same thing that's happening in the boardroom is happening in the bedroom. In the boardroom, women are not getting paid the same amount as men are. In the bedroom, women are not having the same amount of pleasure and orgasms as men are. And that is because we still tend to be focused very much on sex as defined as intercourse, which is sex that is catered more to pleasure for men's bodies. Intercourse leads to orgasm for the vast majority of men, not all, but the vast majority. Intercourse rarely leads to orgasm for women unless it's paired with clitoral stimulation. Because, as I always say to people, the head of the penis, where all the nerve endings are, the equivalent to that is not the vagina. The upper 2/3 of the vagina has no nerve endings pretty much, which is good when you're birthing a baby. But instead, it's the clitoris that is analogous to the head of the penis. And so kind of expecting a woman to orgasm reliably just from penetration is like expecting a man to orgasm from just having his balls stroked. It's not going to happen very often. And we need to change that pleasure gap by changing our definition of sex away from intercourse and really actually focusing on pleasure. Where do women get pleasure? Can women speak up and know their own bodies and express what kind of stimulation will work for them?
It's so funny talking about this because everyone's physical anatomy, all women, their physical anatomy is similar, but some people can find or their anatomy can be a little bit different, right? And then also what feels good to one person doesn't necessarily mean it feels good the same way for another. So a friend of mine and I were talking about this, about how she's never had an orgasm during intercourse and that she always just has to get it through clitoral stimulation only. But then other women can have both through their G spot internally. And some women don't even know. Like I was having a conversation with someone too a while ago that she didn't even know like where her the G spot was in her body. So this can be the last question before we wrap up, but can we touch on just like physical differences and how that can affect your ability to have an orgasm as well if you don't know your own body or don't know how you become stimulated enough to get to an orgasm during sex?
The first thing I want to really clarify, like pleasure is something that happens in the brain. And like you were saying, we might all have the same parts, but that doesn't mean we can predict exactly what's going to lead to pleasure. We have the same mouth and tongue and whatever. And yet the food that is pleasurable to you is not the exact same food that is pleasurable to me, the amount of salt that's pleasurable to you. So the funny thing is, I think with sex, people look for the formula. What are the sexual techniques that are going to reliably lead to an orgasm, as if pleasure, is the same for every person. And just like food or the temperature you like to fall asleep with in your room, the same touch is going to be interpreted in seven different women in seven different ways. Generally, we can anticipate clitoral stimulation is the way to go because that's where all the nerve endings are. So we've got like some clues, but the actual nuance of the touch is going to vary. The second thing, I'm really glad you brought up the G spot. Like the G spot in our field is like the Bermuda Triangle. Like if you cut open a cadaver, a dead body, there is no G spot. There's nothing anatomically there, and yet there is this area that tends to be very pleasurable. And it's thought that it's really pleasurable, not because it's a specific spot, even though that's the way the word is defined, but rather because the clitoris is much larger than what most people think. Most people think of the clitoris as kind of like that nib shaped little piece. And instead, the clitoris has these long legs, these long crura. It's got these big bulbs. And so, for some women, when their clitoris becomes really engorged, just like the penis, it actually is this huge structure and it becomes engorged. For some women, that distance between their vaginal opening and where it's touching on that clitoral tissue is very short. And the more narrow, the closer they are, they can get more pleasure then from the vaginal penetration because it's stimulating the clitoris in a lot of ways as well. Same thing when you're touching internally, depending on how aroused and erect the clitoris kind of becomes in the body, that can be stimulated through the walls of the vagina. Whereas for other women, they'll report, you know what, I don't actually feel a lot there. I don't know where this G spot is. And that's because, again, it's not one spot. It is the way that their genitalia are swelling and becoming aroused. And then it's the way their brain is interpreting it, just like foods in the body. So every woman is different. They're going to have to explore it for themselves. And we need to get away from the idea of like, oh, you just haven't found your G spot, or oh, you just need to do this. It really will be individualized from person to person.
Thank you so much for all the information. I know we're going to need to wrap up. I could sit here and ask you a million questions, a million more questions. So, if people wanted to find more about your work or find you on social media, can you please share where they could do that?
Yeah, you can find me on Instagram. I am at Dr. Carolin Klein, which is Dr. And then Carolyn, my parents spelt my name in a strange way. There's no E on the end of Carolyn, so it's Carolin, and then Klein, Klein. Or you can always reach us at the West Coast Center for Sex Therapy, which is westcoastsextherapy.com.
Thank you so much, Dr. Carolyn, for being here today. I really appreciate your time and thank you for sharing so many great topics and information with us today. Thank you for being here.
Thank you so much for the invitation. It's been a pleasure.